Welcome everyone. You are logged in and joining our webinar today by NDSU Extension, focusing on foaling and foal management in northern climates. So today we're going to cover a few different things. We're going to talk about preparing for foaling, the foaling process, and foal care and mare management immediately after foaling. So the birth of a foal is an exciting time, but it is also a very critical time that requires careful and diligent management. So particularly in northern climates, we have unique challenges where proper planning and preparation really are essential to making sure things go smoothly. Most of the time, foaling goes well, and today we're going to talk about, what to look for that's normal and also what's abnormal. Because when problems arise, they can turn catastrophic really quickly. So being prepared and gaining the most knowledge that you can is just a good idea. So what are the challenges of foaling in North Dakota? Especially not just in North Dakota, but northern climates. So if we look at this image here, this was just from a month or so ago, where we have harsh winter-long conditions. They don't just last for a week or two or a month or two. We have winter for multiple seasons throughout the year. So often starting late in the fall and going all the way into May, and sometimes we have poor weather in June as well. So we have extreme cold. We have a lot of wind and the wind chill that comes with that. We have wet weather. So sometimes rain and sleet and wet moisture can be just as debilitating or more debilitating than cold and snow. We have frozen ground conditions and then the mud and the freeze thaw cycle and the mud and frozen conditions that come with that. Okay, so those are some really extreme situations that we deal with when foaling in northern climates. The other challenge that we have in rural areas, not just in North Dakota, but other areas as well, is access to veterinary care and emergency care for our horses. So making sure that you are as educated as you can be so that you can recognize when things are not going right and you can quickly intervene and contact your vet and get that health care needed, that emergency care that is needed. We also don't necessarily have many reproduction facilities available. So sometimes you'll hear other horse owners say, well, I just take my mare to the foaling center when it gets time. Those just aren't common things up here. So oftentimes we truly are a do-it-yourselfer breeding and foaling operation up here in North Dakota. So what we can do is prepare the best we can, and that's what we're going to talk about now. So the first thing is to know your dates when you're preparing. That close monitoring of pregnant mares is essential. Oftentimes we'll hear people say, well, my mare's due date is this particular one date. And we want to make sure that we think that that's not necessarily going to happen, right? So it can be weeks before or weeks after that date. On average, the gestation length of a mare is 335 to 342 days, but that is just average. So I always encourage people to be ready much, much sooner. It often ranges from 320 up to 400 days, so well over a year of gestation. If your mare foals under 320 days of gestation, that foal is considered premature, and it may have a higher rate of challenges getting started in life, but it is still viable and certainly survivable. So if you have a foal born at 315 days, doesn't necessarily mean that it's all doom and gloom, okay? But there might be some challenges. Typically, if a foal is born under 300 days, it's not often going to be viable, okay? So often when we look at these dates, we want to think, okay, I'm going to figure out when my average due date is, but then I'm going to plan and be prepared and ready as soon as 300 days. So be checking that mare closely, looking for changes at 300 days of gestation. So in order to calculate all this, you need to know your mare's ovulation date, or at a minimum, know what dates the mare was bred so that you can calculate forward and be prepared when foaling time arrives. This can be tricky if you purchase a bred mare without any records or you have a surprise breeding that you were unsure of, okay? So even closer monitoring of the mare in those situations will be essential. Let's talk a little bit more specifically about what to do in that third trimester, so those last few months of gestation. You're going to want to start to monitor your mare more frequently, so certainly daily at minimum, and as we get closer to possible foaling, multiple times a day. Keep in mind that those nutritional requirements change. You want to maintain your mare at that body condition score of a 5 or a 6. They're going to have an increased demand for energy and protein at this stage. So along with having on their normal ration, oftentimes you want to increase the quality of forage if possible, and then provide a mare feed as well, a concentrated feed to make sure that they're getting the extra energy, protein, and then of course the balance of vitamins and minerals that they need as well. You're also going to want to vaccinate for antibody development. So this should occur 4 to 6 weeks before foaling. And the AAEP, or the American Association of Equine Practitioners, has guidelines to follow for pregnant brood mares. And then also check with your local veterinarian if there's any local recommendations in your area that your mare may need to be vaccinated against. This is essential for that antibody development that's passed to the foal through the colostrum when they're first nursing in that first 24 hours. The next thing to think about is where are you going to be foaling? So some people choose to foal away from home versus leaving the mare with them at home and foaling them out themselves. If you're going to move your mare away from home to either a foaling facility or somebody more experienced with tending to pregnant mares, we recommend that you do that weeks before foaling. So 3 to 4 weeks minimum before foaling. And this is so that mare can develop antibody development to that environment. Again, it's going to help get your foal started. If you're going to be foaling them at home, move to the foaling area and get them in the routine of where they'll be foaling at least a week before to get accustomed. And you may need to adjust that depending upon how sensitive your mare is to change. It may need to be earlier than that. Some other things to think about when we get ready to prepare for foaling. If you have history on your mare, review that. So if this isn't her first foal, how many foals have she had previously? How many days of gestation did she go? They don't always stay the same, but some mares trend to always maybe have them a little earlier or a little later. And if you have that record, that's helpful to know. What was the behavior like in last foalings of your mare? All of those records that we're going to talk about in a little bit about what we should write down and keep, review those, get those out and review those and get prepared. If your mare has a caslick, make sure that gets removed at least 30 days before foaling. If you're unsure if they have a caslick, you'll want to have a veterinarian or an educated breeding attendant take a look for you. Determine whether you're going to be foaling inside or outside. So that'll be weather dependent. So checking that weather forecast, also time of year dependent, and prepare those areas appropriately. Oftentimes people in the north will bring their mares inside at night and then maybe turn out for a few hours or throughout the daylight hours during the day until the mare gets real close to foaling. Have a plan for what the herd mate situation is going to be. If your mare is used to living out in the open and you tend to foal out in a large herd, that might be something that is normal for you. But a lot of people with small herds want to separate that mare into a separate pen or a stall. And if you are going to leave them out with others, make sure that it's a large enough pasture for the mare to seclude herself. Let's talk about things to consider as far as the facilities and shelter considerations that are needed in the north. So we want to make sure that our facility is as clean as possible. Daily cleaning, regular removal of manure, help us with those biosecurity concerns as well. We want to keep things dry. So dry and clean kind of go together. We want to make sure that it's spacious. So have enough space for that mare. The bare minimum typically for a foaling stall is a 14 by 14, and that's pretty tight. So the bigger space that you can give that mare, the less apt she is to have that foal against a wall or have trouble with really having enough space to deliver that foal safely. Provide wind protection. So whether you're inside or in a 3-sided shed, make sure that there's protection from wind and wind chill concerns. However, we want to make sure that our facility is well ventilated. So you don't want to lock your mare into a small space that isn't ventilated and doesn't have fresh airflow. It goes back to also keeping things clean and dry so that we have good ventilation and good air quality. We need to protect from severe cold. So if you're foaling in North Dakota in the early winter months, January, February, March, even into April, often, sometimes even in May, we have below freezing, snow, severe wind chills. We need to think about how we're going to get that mare and that foal into a safe, warm area. So think about what heat sources you have. Do you have the availability? Do you have a heated barn? Do you have a heated shop that can be converted to a safe foaling spot? Do you have a garage? What do you have that you can turn into a safe foaling stall for your mare in the instances where we have that severe cold protection that is going to be required? So if it's many, many degrees below zero out or even many degrees below freezing, we need to consider about how we're going to provide a heat source and how we can do that safely. Other things to consider is cameras. Do you want cameras for your foaling situation, and how are those going to be placed? Get them early enough so that you can get them working and hooked up. And then there's also foaling alert devices that are out there. So there's a variety of them. Some are sutured into the mare that will alert you via a pager or a phone call when that mare starts to deliver the foal. There's some other ones that are out there on the market too that you might want to look into for your situation. Next thing we want to stress and talk a little bit about is the importance of bedding. So this goes back to having a clean space, a dry space, and keeping them protected from the cold. Bedding is essential. So oftentimes we hear straw is a good thing to use, and straw is very easy to come by in North Dakota, so it certainly is a good option. You just want to make sure that it is clean straw and dry straw, so it's not wet or moldy or musty or frozen. Straw is often used because they're less likely to inhale the particles that they could inhale with fine shavings. If you're foaling on a hard or a slippery surface, sometimes it's helpful to put shavings underneath to absorb the excess liquids and provide a little extra cushion, and then lay straw down on top to minimize any inhalation of fine shavings dust of that foal. Some people choose to just use shavings, and if that's the case, the larger flake shavings oftentimes have less of a risk of inhalation. Keep in mind that if your bedding is too shallow, it's not going to absorb the moisture well enough, and it's going to be slippery for the mare and the foal. However, if it's too deep, it can be really challenging for the foal to get up above that bedding and to move about. So keep that in mind when you're deciding how much bedding to put in. The key part here is to change it out often and clean it out often. So as your mare is getting ready to foal, clean that stall, have fresh bedding put down. After she foals, do the same, and then clean multiple times a day, particularly in that first few weeks. Anything you can do to help reduce the pathogen load and keep things clean and dry is really going to help you out. Next, let's talk about some of the supplies to have on hand. So Colorado State University, the vet school there, and the Repro lab there has a really great list online that I'll provide in the links as well at the end. And here's just a few things from that list that are very basic that everybody should have on hand. So first of all, your emergency contacts are key. So for your local veterinarian, but also for an experienced horse person or foaling attendant in your area that would be able to come and assist you if needed. Having clean towels, a way to wrap the mare's tail up, gloves, both latex gloves and OB length gloves. A sharp scissor is essential. Having OB straps, some lubricant, a thermometer on hand, navel dip, and a small cup to utilize that dip. Having some fleet enemas on hand, as well as a bucket, is all essential. There's many, many more items to gather, and we recommend you do that well in advance, so well before that 300 days of gestation, so you're ready to go and you have your foaling kit put together. There's also some commercial kits that you can purchase out there that are available as well. Okay, so now we talked about preparation. Now let's talk about signs of impending foaling, so what to look for. The udder development on the mare is going to start to fill anywhere from 2 weeks to 6 weeks prior to foaling. If udder development occurs much earlier than that, it's kind of a red flag that you want to visit with your vet about. Something could be going wrong, or you could have some premature udder development. That's not ideal. Oftentimes, mares will wax but it's not a given. So waxing is when a small amount of milk leaks out of the udder and forms this white substance that you can visibly see on the external part of the mare udder. This will occur on some mares 1 to 2 days prior to foaling. Some mares it does not happen at all. Some mares will wax for many days or even weeks before foaling. So it's not a fail-safe method, but for the ones that do wax, it does give you at least an idea of when to start paying very close attention. So I have some pictures here on the screen just to show you udder development. The first one is about a month out of foaling. The next one is about 2 weeks out from foaling. The third picture that has the waxing present, that was 1 day before foaling. Okay, so just to give you the ideas of the changes in the shape of the udder and then also of the teats themselves as the mare gets closer to parturition. The other thing that occurs is relaxing of the pelvic ligaments. And this can be found by moving the mare's tail around. Their tail will become very loose and easy to move. So doing this and testing this months before your mare's ready to foal will help you determine when some of that looseness starts to occur. So say 2 months before foaling, they still clamp their tail down and have a lot of control. And as you get closer, it'll loosen up likely. There's also some sinking and softness that occurs around the tail head, so feeling that area daily will help you know when those changes start to occur. Some additional signs of foaling is that the mare's shape of the belly will change. So when you view your mare from the side, they will start to have more of a V shape to them right in front of the udder. The mare in this picture here has just a slight drop in her belly. This mare happened to be a maiden mare. It was her first foal. As she gets closer to foaling, that drop becomes more prominent. And if you have a mare that's had many, many foals, that drop might be significant. Okay. The other thing that occurs is changes to the chemical makeup of the milk. So some people will utilize pH test strips and will start to take just a little small droplet of milk from the mare. And when that pH strip drops down to about 6.5 of pH, usually the mare is going to foal in approximately a day. So on average, the pH of a mare that is not foaling is going to be around 7, so it'll drop slightly. So this is one option that you can use if your mare is comfortable and accommodating to you testing this. And again, it's just a small little drop on a pH strip. There's also calcium concentration tests out there as well that you can purchase and utilize. The other thing to watch for is behavior. So knowing your mare is essential. This can be tricky, again, if it's a new mare or if it's a recent mare or something that you don't have a history with. But if you have a history with this mare and it's been around, knowing what's normal behavior for her is key. Oftentimes they'll become a little more restless. They might pace a little. They'll show signs of discomfort, maybe more grunting and vocalization. Maybe they'll be frequently lying down or up and down. And some mares will go and isolate themselves as well. So let's get into the 3 stages of labor. The first one is stage 1, and that's just general restlessness of the mare. That can last anywhere from an hour to 4 hours, sometimes even less. Some mares can be really stoic about foaling, where maybe they're standing around eating hay, and then 10 minutes later they're in active labor. Okay, but if you can catch this time when they're restless, you know that foaling's coming. Okay, so this would be a good time to wrap the mare's tail, clean the mare up, clean the delivery space where that mare is going to give birth, and then otherwise stand back and observe quietly. Try not to disturb the mare during this time. You may see her sweating, generally uncomfortable, frequently standing up and down, looking at her belly, pacing, raising her tail, those sorts of things. If this doesn't advance into stage 2 of labor, it could be a concern because those are signs that are typical of colic too. So you want to make sure that your mare isn't colicking and is indeed going into labor. So again, after 1 to 4 hours, you're going to move from stage 1 into stage 2. And this is the time where active labor and delivery occurs. This is a very fast process in horses. If you've been around other livestock species, oftentimes it can be much, much longer than this. And that can get us in trouble when we're dealing with horses. Horses have foals very quickly. 10 to 30 minutes is normal. Okay, so during this time, you want to watch quietly and do not interrupt the mare. In the first picture on the top left, that is when the mare first had her water break, per se. Um, and from the time that that occurred to the bottom picture where the expulsion of the foal occurred was less than 10 minutes on this particular foaling. These pictures were taken with a foaling camera and the timestamp on them. I had to edit those out, but it was less than 10 minutes for this to occur. So very, very quickly. Oftentimes we would prefer the mare to lay on her side, and she will. You might get up and down once or twice to reposition, and that's a normal, but try not to disturb her during these times. Observe quietly, make sure the labor is progressing normally. And if assistance is needed, if it's minor assistance, certainly go in and intervene and do so quietly and smoothly and calmly. During this process, you want to make sure that the foal is coming in a normal position, which we'll talk about in a moment. And then note that the foal is beginning to breathe as soon as it passes through the birth canal. Okay, so once that rib cage passes through the birth canal, we want that foal to begin to breathe on its own. The other part of this that we get questions on frequently is, what do I do with the umbilical? Leave that umbilical cord intact as long as possible and allow the mare, the foal, to break it themselves. That is the best option. The next stage of delivery is stage 3, and this is when the placenta is delivered. The placenta needs to be delivered in horses within 3 hours of birth. Okay, so if it doesn't occur immediately, what you want to do is carefully and quietly tie that placenta up against itself, essentially. It's kind of a half hitch, tie it up above the level of the hocks. This prevents it from dragging in the ground and also prevents the mare or the foal from stepping on it and tearing it. That added weight helps to expel the placenta as well. Once it's expelled, save the placenta. So you want to examine it for completeness. And if you're not sure if it's complete or you're not comfortable with that, put it in a plastic bag. Keep it away from anything that might get into it. And when your vet comes for that wellness check within the first day, they can evaluate that placenta as well and make sure that it truthfully is all intact and all was expelled from the mare. The failure to pass the placenta timely within 3 hours and completely is an emergency, okay? Retained placentas can cause all sorts of problems and challenges in the mare, and they can be life-threatening as well. So this, again, is something that's different than other livestock species that can tolerate a retained placenta longer. Mares cannot. 3 hours is your time frame. If that doesn't occur, contact your vet for protocols of things that you can do to try to help that along. So there's some hormone treatments that you can give your mare, as well as waiting that placenta to help expel it naturally. Okay, let's get into what a normal position is, because to know what's not normal, we first have to know what is normal. The normal position for a delivery of a foal is 2 hooves and a nose coming first. Okay, so after we have that white sac that expels from the mare, shortly thereafter, in the next contraction or two, we should see a hoof. And sometimes right away we'll just see one. That second hoof should be just a few inches behind it. Okay, so this is where you want to observe quietly for that next contraction and see if you see 2 hooves. Shortly thereafter, just a few inches behind those 2 front feet, we need to see a nose of that foal. These are essential in those first couple contractions, and we want to make sure that they are there. If they are not, that's when we need to intervene. So again, this is normal. 2 hooves and a nose, just as shown in this photo. Here are some abnormal positions that can occur. So you can have the foal's head come first, where the front feet are tucked back underneath. You can have where the front feet and the ears are coming first. So the nose isn't coming, but the top of the head is coming with those front feet. You can have where the front feet and the hind feet get stuck together and the foal gets hung up in the birth canal that way. Occasionally, you can get where there is a head turned back to the side. You can have where there's one leg back, not both legs are coming, but one leg's coming and one leg is stuck back. Foals can arrive hind feet first, which also requires assistance to deliver quickly. And then probably the toughest one to remedy is a breech delivery where the tail is coming first. All of these are abnormal positions that are going to require assistance and they are emergencies. So when do we intervene? Anytime that there's those abnormal positions, we're going to need to intervene to see if we can maneuver that foal around to get into the normal delivery position. Anytime that there's a prolonged labor, it is an emergency. So over 10 minutes of contractions and active labor without any progression of the foal coming out is an emergency. Maximum time would be 30 minutes. And we say this because foal survival is really unlikely past 1 hour of active delivery. And in rural areas in the northern state of North Dakota, it can be a long ways to get a vet to you or to get an experienced foaling attendant to you or to get your mare somewhere where they can be provided assistance. So the sooner you act, the better. It's better to maybe call too soon and then have to call and say, oh, it's fine, everything was delivered fine, than to have to wait too terribly long to make a decision on whether that mare needs assistance or not. So again, anything over 10 minutes without progression, up to a maximum of 30 minutes of active delivery. Anytime there's excessive straining or contractions with no progress or advancement of the foal, we need to find out why that is. Oftentimes that could be an abnormal position, and that's why you're not seeing those 2 feet and the head coming. The other one that is photographed here is something called a red bag delivery, and that's when the premature separation of the placenta occurs. So again, you should have that white amnion that we showed in the previous slide. That's normal to see when we get into active labor. This bright red is not. This is an emergency situation where the separation of the placenta has occurred and that foal is not getting the oxygen it needs. So what you want to do is take your scissors that you have in your foaling kit and cut through that placental, that red bag, and quickly deliver the foal as quickly as you can for the best chances of survival. So again, when things go wrong, there's really not a lot of time to wait in horses. Get the vet on the phone. You can often do a video call. They can walk you through some of the things until they can get there to assist. Next thing I want to share with you is some documentation and record keeping. So we mentioned how vital this can be when you're preparing and getting ready and thinking about all the things you need to do for foaling. Here are some things to jot down on a sheet of paper. Have the dam's name and the sire's name. Have their due dates, and not just one due date of the average date of that 335, but start at 300. Because technically, or sometimes a foal can be viable past 300 days. So we want to start making sure that we're paying attention as soon as 300 days, very closely to that mare. And then put the 320-day mark, because that's the consideration when a mare before 320 foaling would be considered a premature foal. So 320 days, have that as kind of a mark on your calendar. Then 330 and 340. Hopefully by then your mare's getting close to foaling, and if not, you're probably getting pretty anxious and waiting for them if they're going past those dates. A mare going up to a year or even over a year is not unheard of, so don't be too alarmed, but again, recording those due dates really helps you track that mare along through her gestation. Then actually document the foaling date that did occur and calculate backwards how many days it was. Like we said, this can be helpful from year to year if you're keeping and foaling out the same mare. Sometimes those mares will show you a pattern. It's always helpful to know that. Document the delivery time of day and how long it took. So what hour of the day, and then was it 10 minutes, 20 minutes, 30 minutes? How long did it take? Document the signs of impending foaling for that mare. So write down when she first bagged up, when she waxed, if she did, how long she did she drip milk, did she stream milk, when did you notice her ligaments loosening, When did you notice the lengthening of her vulva? Those sorts of things. You can also take pictures and include these in your records as well. Document the foal's sex, their weight, their color, their markings, just a description of the foal. Document when you treated their navel for the first time and each time for the first few days. Document normal foal behavior. So did the foal get up and seek out the mare immediately? What time did the foal stand? What time did it nurse? What time did its meconium pass? What time did the mare pass her placenta? Document the time that the IgG test was taken and the results of that test. If you have to administer a plasma or administer plasma as an insurance type policy, what time and day did you do that? What time did you give ivermectin? It's recommended to deworm mares with ivermectin on the first day after delivery, and this helps to minimize parasite transmission through the colostrum to the foal. Document the mare's behavior. Was she quiet? Was she anxious? Was she aggressive? Document what happened there. And really, any additional notes that you can provide, document those. You can never have too many details when it comes to record keeping around foaling. Let's switch and talk a little bit about post-foaling care for both the mare and the foal. So again, it's essential to keep quiet and observe. Oftentimes we can do more harm than good if we get in the middle of the birthing process and of that bonding process shortly afterwards. So stand back and keep quiet and observe. Again, ensure that foal is breathing as soon as those lungs transmit through the birth canal, and clear that airway if needed. If the amnion is covering the nose and the mouth of that foal, tear that away, peel that back so that has a clear airway. If it's extremely cold out, drying, rough toweling off and drying may be needed. Or if you weren't able to foal somewhere warm, moving that mare and foal to somewhere warm might be necessary. Ideally, we'd like them to foal where they're going to be able to stay undisturbed for a few hours afterwards. Monitor the mare closely. Oftentimes post-birth, they can have colic-like symptoms, and if they're in a lot of pain, they're having a lot of cramping, they're passing that placenta, they may ignore their foal. They can put the foal at risk if they're going down and rolling and being agitated. So keep that mare safe. You may need to pull the foal to the side until you can assist that mare. That mare becomes less painful. Anti-inflammatories may need to be administered. Visit with your vet about how much and when. Oftentimes it's recommended to wait until they've passed their placenta to administer them unless they're extremely painful with severe colic-like symptoms due to the cramping. Observe the mare for any abnormal bleeding or excessive bleeding that can occur. So there are some traumas that can occur that could be an emergency situation. So we want to monitor that mare closely as well. Sometimes we worry so much about the foal that we forget to take care of the mare first as well. Over on the right side, we have kind of a general rule of 1, 2, 3. These are essential timelines. So the foal needs to stand within an hour, and oftentimes a couple minutes out of that mare, they're sitting up on a recumbent and sternal position, just a few minutes out, and they're trying to stand with very shortly after that. So within an hour, we want them to have successfully stood. We want them to have nursed within 2 hours. And their meconium passes at about this same time, within 2 hours. And the placenta needs to pass within 3 hours for that mare. So those are the kind of the key 1, 2, 3 timeline marks. Let's talk about the importance of that early nursing and colostrum intake. So colostrum is the first milk that foal is consuming, and it's essential for passive immunity and for survivability of that foal. This is how antibodies get transferred to the foal, and it needs to happen as early as possible after delivery. So again, that early nursing is critical within 2 hours, and you want to observe for frequent brief nursing sessions for each hour afterwards. So don't just say, all right, I saw the mare or I saw that foal stand at 1 hour and nursed within 2 hours. I'm out of here. I can check them again tomorrow. Check back hourly. That foal should be standing and nursing multiple times throughout the hour for just a few minutes apiece. Okay, that's how we're ensuring they're getting enough of that colostrum and enough of those antibodies. It's recommended that you do an IgG test at approximately 24 hours after birth. Even if you've seen that foal nursing frequently, you want to make sure that they had enough IgGs transferred to that foal. If the colostrum quality is poor or the milk quantity is poor, you can have a foal that is actively nursing that still fails their IgG test and will need a plasma transfusion in order to get kind of that kickstart on life and stay healthy. There are chute side tests that you're able to do. So visit with your vet if you're comfortable conducting some of those tests. If not, it's recommended that your vet get out and do a well foal exam in that first day of life anyway. And this would be a time when they could take that IgG test. The meconium is the first manure that the foal passes, and it's small, brown, black little pellets. And these can sometimes get impacted and cause discomfort. And if that foal is uncomfortable, they're not focused on nursing. So if they're straining and not nursing and looking painful, an enema can be administered. Okay, so warm it up to body temp. These are available over the counter. Using just a half a bottle is often plenty for a smaller foal, and you can always administer the other half of the bottle or additional enemas until that meconium is fully passed. Next, let's talk a little bit about umbilical care of that newborn. The navel should not be cut. So again, it can be tempting when that foal is born. You want to get in there and dip the navel and help rupture that umbilical cord. Let the mare and foal do that on their own timeline naturally. Let them rest unbothered. Don't encourage the mare to stand right away. Don't encourage the foal. Oftentimes that foal is going to be moving around and break it naturally, or the mare will naturally stand on her own and break it. It's recommended to dip the navel 4 to 6 times in the first day and 2 to 3 times after for the following 3 days, or at least until that navel is dried up. And we dip it with a dilute chlorhexidine solution and check it each time for any swelling, heat, or tenderness that would be signs of an infection and need treatment. Something we see a lot in northern climates is cold foals. So hypothermia prevention, how do we deal with it? So first off is knowing what the normal body temperature is. In a non-stressed foal, 99.5 to 101.5 is pretty typical and normal. If you get under a body temperature of 98 degrees, you want to call your vet. Over 102 is going to be considered a fever, also an issue. But as far as hypothermia goes, if you get below 98 degrees, we want to make sure that we're keeping that foal warm and starting to warm it back up. Signs of hypothermia can be excessive shivering, just kind of a lethargic, not thriving foal, cold extremities, and then use a little bit of common sense with it too. So if it's pretty cold out and they're windy, they're wet, they're not bedded, they were born unattended, any of those things, get them inside and get them warmed up. It is an emergency situation. So you can warm that foal up with heat lamps, warm blankets, heat packs until vet care can get available. How do we prevent it? Keeping them dry and healthy is the first step. So a healthy foal that's been nursing and sheltered from poor weather can often handle some cooler temperatures, even in North Dakota. So they can handle below freezing temperatures. They can handle some of that if they got off to a good start where they're nursing and they got dried off and warm from the get-go. Using foal blankets can be recommended if it's under freezing temperatures or wind chills are under freezing. You want to make sure that they're sized appropriately, though, for safety. So you don't want to get your foal, newborn foal, tangled up in a blanket that is too large or has straps that aren't safe, those sorts of things. Use dry, deep bedding to keep them warm. And again, go back to what do I need to do to provide adequate warmth when I'm foaling in North Dakota in the winter and the cool spring months? Do I have a heated barn, heated shop, heated garage? Do I need to take them somewhere? Do I need to bring in external heat sources to my unheated barn? What do you need to do and be prepared to make those things happen before we run into a hypothermic situation? Okay, additional concerns. Man, there's a lot of things to think about and worry about, but knowing about these and doing your research ahead of time allows you to spot them so that you can remedy them quickly. Anything out of the ordinary on a newborn foal is an emergency. So again, remember that we don't have a lot of time to correct problems, and foals can crash very, very quickly. You can think, I'll wait until morning. I don't want to bother my vet, or I don't want to load up and go to the clinic at this hour or the middle of the night or whatever it might be. Again, foals crash very, very quickly. So erring on the side of caution is always recommended with a newborn. Diarrhea often occurs in foals a week or so after birth. We have the foal heat diarrhea that occasionally happens, not on every foal. Sometimes this can be harmless, but we still want to make sure that they're not getting dehydrated or scalding their legs. So noting that and treating that appropriately is important. More severe types of diarrhea can be caused by viruses, bacteria, and parasites, and those will need to be treated by your veterinarian. So any signs of diarrhea should be monitored and put a call into your vet. Other concerns can be something called a patenurachus, and that's where urine is dripping from the navel, and that'll need to be corrected. Ruptured bladders can occur where the urine will pool in the abdominal cavity, and that's an emergency that'll require surgery as well. A swollen navel that's hot or inflamed or tender to the touch is an emergency. Colic in the foal, it could be early on, it could be from that impacted meconium, but there's many other things that can cause colic or abdominal discomfort. Colic in a foal will often look like a foal laying down and kind of flopping over back and forth or up and down and flopping to the ground. So that is abnormal in an emergency situation. Next one on the list is what often is commonly called dummy foal syndrome or a failure to thrive of a foal. And this is hypoxic ischemia encephalopathy. Okay, so that's something to be concerned about. And these foals often are born normal, or they may or may not be born normal. Maybe they get up and they're fumbling around, they're not nursing as frequently or as easily as we'd like them to see. Again, these ones can crash very soon. So getting emergency care is important. A few other things to be concerned about and do some research on: neonatal isoerythrolysis, limb deformities, and there's so many more things that can occur with our newborn foals that need attention. So being aware of these and doing your research ahead of time, again, just helps you be more prepared and be able to treat the issue quickly. Let's talk about some early movement and turnout considerations in the cold north. Okay, we want to make sure that we turn out our mares and get them the exercise, but we want to have safe exercise areas. So avoid icy, slippery areas, deep snow, deep mud, or when we're in that freeze thaw cycle where we have frozen mud in the morning that's really bumpy, has all those hoof-shaped holes in it, and then it turns into cold, wet mud in the afternoon. Those aren't great conditions to turn your horse out in. Also avoid any wire fences or unsafe fencing with a newborn foal. Gradually exposing your mare and foal to larger spaces for larger times is recommended, rather than taking them from their foaling stall and just turning them out into a large area where, again, they could encounter the ice, the deep snow, mud, those sorts of things. So gradually expose them to larger areas. Make sure you remove any unsafe obstacles, and then remove halters and any leg straps from blankets. Ideally, we wouldn't want to have our mare blanketed, but if for some reason that was necessary, make sure that it's the type of blanket that doesn't have any leg straps that can entangle a foal. Some other considerations for early movement and turnout: gradually expose them to winter outdoor conditions. So this picture here was a mid-April snowstorm. This foal was probably a couple weeks old at this point, so it was able to go outside for short periods of time. So a short turnout to stretch its legs, let that mare exercise as well, and brought back inside. So turnout during the sunlight in the warmest part of the day is recommended. Provide dry bedding outside for the foal and the mare to lay down on. Provide a windbreak for them to get out of any extreme conditions. And think about limiting exposure. If you had a weak foal or a premature foal, limit exposure to cold conditions outside. And of course, watch for frostbite. So Typical areas that are going to get hit first are going to be the ears, the tip of the nose, the end of the tail, and the hooves and portions of the leg that come in contact with severe cold. So frostbite is a real thing. Sometimes we think, well, once the mare is dry and a couple days old, that the frost bite elimination or the risk for that is eliminated. And that's not always the case. We can get frostbite on foals that are older than that as well when we get severe cold conditions. So let's review a little bit. We went through a lot of things very quickly, but here's kind of the take home and the highlights. Remember, foals are extremely vulnerable, so always err on the side of caution. Know you're normal so you can recognize when things are abnormal. Do not wait if anything is out of the ordinary. Get that call in immediately. Develop a relationship with your veterinarian well before foaling. So you want to make sure that they know your mare is pregnant. They know when you're expected to foal, so it's not a surprise. Keep that relationship going and open with your veterinarian. Have an experienced foaling attendant on standby. So again, we talked about the veterinary shortage and they may not always be able to get to you. So do you have a backup plan? Do you have some other experienced people in your neighborhood that can be on your emergency contact list? Get in touch with them, let them know all of the timelines that you're anticipating as well. And then cold weather foaling really creates additional challenges. Okay, so keep them warm and dry. That is the essential, the most basic and essential thing is warm and dry, however you need to do that. Provide bedding and shelter, and must have adequate space lined up to accommodate the poor weather. Because again, even if you're thinking, oh, I'm not foaling until April or May, we can get a rainstorm, we can get below zero in April, we can have all sorts of conditions that are just as bad foaling in April and May as it could be foaling in January and February. You just never know exactly what the weather's going to be when your mare foals. So keep that in mind and plan ahead appropriately. Hopefully this has given you some tips and tricks and things to think about. I want to share this slide for some additional resources where you can really dig in a little bit deeper. We have some great resources here, and we will send these out afterwards in an email, so you'll be able to just click on them and access those links as well as the recording. So at this time, I am going to open it up for questions. If you have some, please put those in the chat box or unmute your mic and feel free to ask verbally. And I'd be happy to entertain any questions that you may have. All right, so I'm just going to pull up the chat here. And is there a point where you can ultrasound to see the position of the foal? So, you know, I'm not a veterinarian, so I'm going to give you my experiences on this. Is when that foal gets into that late term, ultrasound isn't really useful anymore. Okay, so as far as ultrasound to determine the position of the foal right before foaling, no, that's not a useful thing to do. It's highly on feel at that point. The next question I see is, with a red bag delivery, is the foal in normal position? Will its feet and nose present? Sometimes. So at that point, it's an emergency. So we're going to cut that red bag and we're going to get the foal out. If it is coming with its front feet and nose, that makes it a little bit easier to assist. The easiest place to buy IgG tests through your veterinarian. So most of them aren't available. Oh, I shouldn't say most. The ones that I'm familiar with are available through a veterinarian. They aren't able to be purchased just by anybody. So contact your veterinarian. There's a variety of them out there. And it does require a blood draw. So that's something that your veterinarian is likely going to need to come and do anyway. Or an experienced attendant, foaling attendant. The next question is about hernias. Are hernias common at birth? Any first signs to watch for with those? So hernias can occur at birth. Sometimes it's for a variety of reasons. So they can occur at birth. Sometimes they can go away on their own as the foal grows. Sometimes you can visit with your veterinarian about a kind of a daily exercise or manipulation of that hernia that can help that hernia heal. And other times they're going to require either a procedure or even a surgery to heal. So some hernias are believed to be congenital and some are due to environment or when the umbilical cord detaches. Sometimes a hernia can result. So there's different types and kinds of hernias. The next question I'm seeing is what to do if a foal does not nurse within 2 hours. So the first thing would be to get your veterinarian on the line because you're likely going to want to run plasma on that foal. Assisting it, there's a variety of different ways to assist it. If you'd want to milk a little bit from the mare, get that foal interested in the milk. Sometimes they just need a little bit of help finding the right location. Sometimes if they have no suckle reflex, that's more of an emergency situation that really requires veterinary intervention really, really soon. If they're just a little delayed and that suckle reflex is very strong, but they're just having trouble finding the udder, maybe they're nursing on the shoulder and between their front legs and all the wrong places, you can gently guide that foal. Most of the time, the foal does figure it out, and it can be really frustrating to sit there and watch that foal kind of stumble around and you just want to get in there and help. But experienced foaling attendants will tell you, give them that. If they're trying, give them time because sometimes the more you try to help them, the more resistance you get, and it doesn't always go very smoothly. Once you get to that 2 hours, or if there is no desire to try to suckle, that's when you're going to want to intervene. Sometimes getting just a little taste of milk on your fingers and wiping that along the foal's nose and in their mouth will help stimulate them to get excited about trying to nurse too. Yeah, there's a mention about something called the Madigan squeeze, and that's something that's used in our failure to thrive foals or a dummy foal syndrome. That's certainly an option you can do some research on and visit with your vet about too if you have a foal with no suckle reflex. If there's no other questions, I do want to thank you for joining us today. Thanks for being engaged and asking questions. And I do encourage you to check out some of these resources, do your research, and do your best to be prepared. It can be a really exciting time. And I know sometimes we focus a lot on what can go wrong. And I just want to emphasize that most of the time it goes right. But when things go wrong with horses, they go very wrong and they go very wrong very quickly. So doing your best to be as educated as possible will it'll set you up for the best success that you can hope for. So again, thank you everybody for participating today. We will be sending a recording of this as well as a link to the resources to you in your email inbox. So keep an eye out for that.